Doug Wagner with you on Tuesday, September 12th of 2023, and it's just 9 days from now on September 21st. UnityPoint Health St. Luke's Hospital is going to be holding a joint replacement seminar, joined by Dr. Jeffrey Nassif, orthopedic surgeon of Physicians Clinic of Iowa Department of Orthopedics. He's talking with us here on the morning show. Dr. Nassif, Jeff, good morning to you. Number one, you've taken care of my knees, taken care of Laura's knees as well. I know a lot of people whose legs and hips you've taken care of. We're getting to that age where you're going to have to start looking at some joint replacements, whether it be hip or knee. What's the first thing that people need to be aware of when you start thinking joint replacement? Good morning, Dr. Nassif.
Good morning, Doug. Thanks for having me. Well, the first thing we think about is pain that is limiting a person's activities. So if you can't do the things you want to do any longer, and you may be taking medicines like Tylenol or Advil or Aleve, and maybe your family doctor is giving you a cortisone shot, and despite all those things, you still can't do the things you want to do, that's the time when you want to come see an orthopedic surgeon for a discussion of a joint replacement.
Yeah, a lot of times I think that you recommend doing some sort of a therapy or doing some sort of exercises in order to minimize the pain, maximize your ability to move. But at some point, those things just kind of fall apart. And what's some of the worst things that you see as far as, is it arthritis? What exactly is it for knees and hips that really debilitate people's ability to get around?
Well, the main problem certainly is arthritis. There's multiple different types of arthritis that a person can get. But we see things anywhere from, fractures, trauma, arthritis, dislocations. All those various things can cause arthritis in a person's knee. There's many causes, but the bottom line is the end result is loss of cartilage and bone-on-bone arthritis that causes the pain.
You know what? So many people, I think, take a look at they remember what it was like maybe even 10, 15 years ago. That was another generation or two back in time from these more modern joint replacements. Tell me about the change in technology that's available now and how it helps to minimize the pain and maximize the rapidity of healing.
So we have probably the greatest thing, I think, is what's called a perioperative pain management, where we do different things with different medicines and injections and nerve blocks to help minimize postoperative pain and to facilitate rehabilitation. When I started here in 1998, about a year and a half before that, they used to keep all hip replacements in traction for a week in the hospital before they got them up walking. Nowadays, we're sending people home the same day. Young, healthy people, we operate on them at the outpatient surgery center, so they're able to go home the same day. And that's all a result of our surgical techniques and our perioperative pain management with minimally invasive surgery to help improve outcomes and ease of recovery.
That's absolutely remarkable when you think about that. It's like a night and day difference. It's going to be at Physicians Clinic of Iowa in the Medical Pavilion 1. It's over on 10th Street in Cedar Rapids. September 21st is the date from 6 to 7:30. There's going to be a free joint replacement seminar. You're going to be taking questions from people, and also you're going to have like a look at some of the technology that's there. You're probably going to have some of the joints, the hip joints or the knee joints that you use to replace. I mean, let's not sugarcoat it. It's a brutal surgery, but the surgery is necessary to take care of some brutal pain that people suffer from that is absolutely debilitating. Dr. Nassif, it can not only be physically, but it can be mentally demanding. Do you have to go through that pain as well?
Well, and I kind of tell people beforehand that 50% are getting over the operation, the other 50% is the therapy, and the therapy is very, very important afterwards to help regain range of motion and strength and get you back to the activities that you want to. But, once a person gets through this, really the biggest complaint we get from people afterwards is why did they wait so long, because it literally makes their pain go away, and it felt like it did 10, 15, 20 years before.
You know what? I know somebody who had a double knee replacement. And that's something that never would have been, nobody even would have ever thought of that maybe 10, 15 years ago or so, it seems like. But now it's one of those things where the way that you do these things, and like you said, the pain management, they can get up and get moving on it the same day.
Well, and they do, and we do. That's part of help minimize postoperative complications. It's very important to walk the same day, and so everybody gets up the same day. They walk. The outpatients actually walk up and down stairs. They have to walk a certain distance down the floor to be able to go home, and they're all able to accomplish that because they have minimal pain the day of surgery.
Dr. Nassif, can you give me an idea, roughly what percentage of Americans have to have joint replacement, whether it be a knee or a hip joint replacement? And is it pretty much everybody that's going to end up with something like that, eventually?
Well, I can't give you an exact percentage. However, I will tell you that the numbers are exponentially rising. No, not everybody's going to need it, but it's certainly a reasonable percentage of people are going to need it, and every year the numbers just go up and up and up, and the predictions are astronomical in the future.
It seems like it used to be just, athletes like a Bo Jackson or somebody like that, maybe somebody who was in the military or something along those lines, but now it's just getting, there's so many people that are so active and they do so much exercising, and that can take a toll on you. Is there any way to pull back on that? I guess we've maybe just got a couple seconds left. People just have to be smart about what they're doing and listen to their body's pain.
Right.
Part.
I think you're right. Just staying fit and trim and active actually is helpful versus the opposite.
Working on that, Dr. Jeffrey Nassif. This free joint replacement seminar, go to unitypoint.org to find out more, unitypoint.org to find out more about that. Dr. Nassif, thanks for joining me today. Have a terrific Tuesday.